According to worldbank.org, women make up 50.5% of America's population. Spreading information about women's health statistically decreases the mortality rate in specific illnesses for women. I will be discussing breast cancer and the signs, symptoms, diagnosis, and treatment that go along with it. I have credibility in this area because my grandma battled breast cancer twice, and cancer runs in my family, so I've been taught how to keep myself healthy. Women's health is not just an issue that concerns women. Men with this knowledge can help better look out for the women in their lives. So being educated on breast cancer is a powerful way to keep yourself safe and those that you love. So the first thing to know is the signs and the symptoms. CDC.org says that some symptoms to look out for are lumps, flaky skin on the breast, nipple discharge, and abnormal pain in the breasts. And because cancer is a mass overgrowth of cells that happens in the body, sometimes there are no symptoms. And that is why the next point is super important. So understanding the diagnosis of breast cancer is a way to expand your knowledge on that specific type of cancer. Mammograms are the main diagnostic tool to catch breast cancer. And hopkinsmedicine.org says that mammograms are essentially a x-ray examination of the breast, and women over 45 should get one every year. For younger women, this isn't necessary unless you have a family history of breast cancer, and however, you can give yourself a self-exam just by feeling for any lumps or abnormalities. So after discussing the symptoms and the diagnosis of breast cancer, it's valuable to know the treatment options. So radiation and chemotherapy are generally the most well-known treatment therapies, and that basically is where the cancer cells are shrunken and killed very invasively. And cancer.org says that hormone therapy is also an effective way to treat breast cancer, and that is where the hormones that keep the cancer cells alive stop being produced. For my grandma personally, she chose to do radiation and chemotherapy, and when that was unsuccessful for her, her doctors presented her with an option to have a mastectomy, which is the surgical removal of one or both breasts, and that decreases the chance of the cancer coming back by 95%, according to cancercenter.org. So educating people on the signs, symptoms, diagnosis, and treatment of breast cancer is very useful in keeping women safe. It has saved my grandma's life and many others. So implementing this knowledge into your daily life can really benefit